Hello, my name is Debbie Lamb, and I'm going to talk about physician-assisted suicide. If you're going to die with a terminal disease, would you want to go through the motions of everyday life or end your life on your terms? Physician-assisted suicide is hugely debated all over the world. PAS is legal in Oregon, Vermont, Washington, and Montana. This involves a physician providing a patient at his or her own risk with a lethal dose of medication which the patient self-administers. We do this every day to our family pets. Our pets get ill with a tumor. We ask the veterinarian to give him or her an injection that puts them to sleep. If this is okay for the animal that we love, then why is it not acceptable to those that are sick? Because we do not want to suffer through an illness that cannot be cured. Individuals that oppose PAS state that ending an innocent human life is both morally wrong and unfortunate. Physicians, when graduating from medical school, have to recite the Hippocratic Oath. This oath states that I will neither give a deadly drug to anyone who asks for it, nor will I make a suggestion to this effect. To use PAS is a violation to this oath. However, on the other hand, to relieve a patient of continued pain would be a positive resolution to the patient's suffering. The pros of PAS is that the patient will be able to die with dignity rather than a shell of the person they once were. They die knowing it was their choice. Healthcare costs will decrease because they will not be in the hospital for extensive periods of time. The nurse or physician can move on to another case that has a chance of living instead of spending their time helping a terminally ill patient. Pain of the patient's family will be reduced. Vital organs can be saved and used to save other patients. And without physician assistance, people may commit suicide, and that's messy, horrifying, and traumatic to them and to their family. The patient has to request this medication. The physician cannot suggest physician-assisted suicide. The proper steps for physician-assisted suicide is to first make an oral request to the physician. Then you have to wait 5 days. Third, make another oral request to the physician. And then you have to make a written request to the physician and then wait 48 hours to pick up the prescription from that physician. Finally, patients picking up a prescription from the pharmacy, then they take that medication when they feel like they need to. Brittany Maynard is an example of a patient that had used physician-assisted suicide. If you picked up a magazine, you've seen her name all over the magazines. She was a resident of Oregon. She was diagnosed with a terminal illness of brain tumor. She decided to end her life in November of 2014. She wanted to die with dignity. So she moved from California to Oregon. She quotes, "I am not suicidal. If I were, I would have consumed that medication long ago. I do not want to die, but I am dying, and I want to die on my own terms. My question is, who has the right to tell me what I don't deserve, that I don't deserve this choice, that I deserve to suffer for weeks or months in tremendous amounts of physical and emotional pain? Why should anyone have the right to make that choice for me?" In closing, I believe if a person is dying of a terminal illness and has no way of survival, they should have the right to choose to die with dignity. If we are able to end the life of a beloved family pet, then why can't we help a person to end their life with dignity. I know that in the Bible, suicide is a sin. Like Brittany, these people are already dying. So why not help them with a death that will help them end their life on their terms? Thank you.